When we get pregnant moms in our clinics, the main thing that the moms will talk about is their low back pain, sciatica going down one leg, either their right or their left or both, or their inguinal or their round ligament pain. So what we do in a chiropractic setting is we can get the mom face down and we look at their pelvis right away and their hips. So when I get my moms, the first thing I want to make sure is that mom is comfortable. We have a pregnancy pillow for the baby. The first step that I look at is the pelvic position, and I verify the pelvis with the leg length discrepancy, right? So if I get mom in relaxed position and I look at the leg length discrepancy, I want to look at, is there a short leg or a longer leg? If there's a short leg, a lot of it's coming from the pelvic dysfunction. If I see right short by about a half an inch and I come up to the pelvis, I'm going to verify through palpation. So as I kind of go into the pelvis, I want to see what position this pelvis is in and what position this they're all one bone, but there's two pieces here. And then I want to look at the sacrum. So once I get my listings on what I want to kind of mobilize, where they're kind of feeling stuck, I'll verify with the patient if one feels tighter than the other. So the first thing I would want to do is kind of go into this right side. And when moms get later in pregnancy, you can just kind of give some pressure like this, and you hear what we call a cavitation, a release of pressure. And so the bone did move with just a little bit of pressure like this. So if I look at the hip, a lot of times mom are struggling with internal rotation of the hip. So I'll take my thumb and I'll try to get around the pelvis region here where the piriformis muscle is. That can cause sciatica. So I want to make sure I kind of release this muscle along with mobilizing the structure of the pelvis through this type of care like this. And it's very gentle. Mom should feel okay. Mom should never feel like there's pain with any of this. There may be a little discomfort because they're already in pain, but there shouldn't be more pain from the treatment.